We're here at the CROI 2017, and we're here with Kara Chu, who's with UCLA. We visited with you before on a panel with the young investigators. We were going to have a panel tonight, but it just took us so long to do the programs that we did today. We didn't have a chance to really recruit the panelists today, as it were. But since you were out, what was it, 2 years ago? Was it in 3 years ago? 3 years ago in Boston, that we visited with you, and life has evolved for you, and as a young investigator. And I guess you're at the point almost where you're not quite sure if you're a young investigator. You consider it?
I'm still a young investigator,
Okay,
but reaching the tail end of that.
Right, but this is an important moment for you. Where now you're going to have to start thinking about being a mentor.
Yes.
And who could be better to be a mentor than somebody who's recently a mentee?
That's right, yes.
So, although I know most of the mentors I know are, at the end of their career.
Further along.
Yeah, they're end of their career. And they're saying, I need, last minute, sound like breathing a little life into their, back into their field by getting new blood into the field. And it's exciting for you. But I think you would be a good place to start is where you were and where you are now, and what you see as maybe a future, because you're in the field of hepatitis C. So describe that feeling to us.
Well, a few years ago when I was on the panel, I had, I think, just joined the faculty at UCLA, and so now several years in, I feel quite seasoned. And my research has focused on hepatitis C co-infection and HIV, looking at treatment outcomes, but mostly focused on cardiovascular and metabolic complications of hepatitis C infection. And a lot has changed in the last few years as far as hepatitis C treatment, since there are a number of great new therapeutics, and we really are looking at cure of hepatitis C in the majority of patients who are treated. And so that has implications for the kinds of questions we answer and for my research career, where maybe I might need to pivot as far as my research focus, thinking about what kinds of questions still need to be answered and whether or not those even relate to hepatitis C or might be related to other comorbidities in HIV. And I'm thinking about looking more at just purely liver disease and HIV independent of viral hepatitis co-infection, and then other immunologic complications of HIV.
Are you are you feeling comfortable financially, or do you?
I think
because I know that's always it's kind of like the actors. They always say it's always good to be working.
Yes, that's right. I once heard someone say that at every point in your career, every day, you should be simultaneously working on writing a grant, writing a paper, and then actually doing the research. So I don't think that that ever changes, and because funding is project periods are finite. That we're always thinking about the next step, and it takes so long sometimes to get that funding from the time of conceiving of an idea to actually writing the grant and having the grant reviewed and finding out the outcome, and then likely resubmitting, that we really do have to think at least, I think, a couple years in advance. And so a big part of research is the concern about stability of funding and future funding and being able to continue to do this work.
From what you see here at the CROI, which is a great swath of the landscape, of the science landscape for HIV and hepatitis too, and even TB and malaria and so forth. But what do you see as far as the landscape? Do you see it evolving, or like it seems to be for you? And
yes. So over the last few years, there has been, I think the biggest emphasis has been on cure, and then also on pre-exposure prophylaxis for HIV prevention, and then in the last couple years, comorbidities, non-AIDS complications like cardiovascular disease and other end organ disease. But I think that the focus is shifting much more, even more to cure.
Cure of HIV.
Cure of HIV.
Because we have the cure for hepatitis C.
Yes, we do now.
Now we can get the funding. and the price is down and so forth, I think we'll be able to
actually eliminate potentially the problem of hepatitis C. I think you raise a good point, which is that there's still a lot to be done, even though these drugs exist for hepatitis C, as far as actually getting it to the population in need of treatment. And maybe that's where some of the research is going now for hepatitis C, which is in the implementation of treatment instead of identifying the therapeutic options, since we have those now.
Or more statistical, saying this is, I mean, Mike Sagg did it many years ago, saying this is a much more affordable disease when we prevent it.
That's right.
And
Yes.
also treat it.
Yes.
Both, and treatment is prevention, so it's the same.
Right.
But this is the direction I think. I don't know whether that'd be something you'd want to engage in, but because it's something that we're basically proving the point of the science proves that we are better off treating this disease as quickly as possible, because basically treatment is prevention in hepatitis C as well.
Right. And I think that there is still a lot of opportunity in Hep C research as far as treatment as prevention, and maybe we can't forget that the transmission is still a problem, even though cure exists.
Well, you can be reinfected.
That's absolutely true. That's
and I think that's another. I don't know if it's called bone of contention, but it's certainly an issue for funders or payers to say, okay, how many times are we going to get this person out of the woods on this thing? Because it's curable in almost all cases.
Yes.
But
so probably treatment has to be tied in with behavioral interventions, and that's always a challenge.
I don't think we do enough education about acquisition.
I think that's absolutely true. I think individuals are really unfamiliar with what the real risk factors are, especially if they are not using injection drugs, which is what we classically think of as the risk factor for hepatitis C.
So where do you see some of your colleagues? I know that you mentioned earlier there's challenges for people.
Yes.
We want to bring, the reason we're doing this program is so that we can have people look at this and say, hey, this is the most, AIDS itself and HIV is the most complicated disease in the world.
Yes.
And if you want to get into something that's really challenging, and you feel like that's what's going to make your life successful, then this is probably it. But by the same token, you can say it's very challenging, but you also have to be very good, because you're going to be in competition with others who are also probably very good as well. So it's competitive
with limited
field.
funding.
With limited funding, yeah.
Yes. Well, I think that I do believe in persistence paying off. I think that.
And you were saying the squirrel thing, where you got to keep trying to go for the nuts, pack the nuts away, with the fact that you have to be looking for grants, doing the work, and all of this all at the same time.
All at the same time, and I think that what really drives a lot of us, besides the creativity in research, which is I think one of the great things about being a physician scientist, which is that research is really, to me, a lot more creative than clinical medicine is, and that's really fun. And the ideas you pursue are your own, which is really exciting. But also, I think that many of us are driven by the opportunity to make a difference in the future, and to change clinical practice, to improve individual lives and lives on a public health or population level. And so for me, I really see research as a way to be an advocate for patients, and to translate those gaps that we identify in patient care or patient outcomes into real change through research.
I'd like to do a survey at some point, because I've been realizing that it's not all altruism that drives the scientists to be who they are, or to do what they do, because it's it'd be a very interesting thing to see whether people, it's just a job, or which I don't think it is in almost any cases. It's probably it could be altruistic. It could just be a quest for science, a geekish quest for science or something. Or caring for people, which is more clinical science, clinically relevant.
Yes.
But that would be an interesting study to follow.
What really drives people
Yeah.
in this area of work, yeah.
Because it seems like you're one of my favorites because it's to me it's the science. It's also knowing that at some point you're going to help people.
Yes.
You know,
I think
and
that's the end
ultimately,
goal, really,
yeah.
that you want to see the impact.
Right, there's an
Yeah,
impact at the end of
yeah.
the line. And even if you weren't a part of it directly, indirectly, it's like even bench science contributes.
And absolutely. And that's really been a translation of all kinds of research to the clinical setting, including bench research to the clinical setting. I think that's, in my mind, what I often think of as translational medicine is how to take very quickly what's found in the lab and apply it clinically. That's been a real movement for some time now. Yeah.
One of the other things I wanted to ask you was I'm sure mentors like to have their mentees fill all the little requirements along the way in growth, such as making presentations, especially to conferences like this.
Yeah.
Is this something that you find is is very typical? I mean, there must be mileposts or mile markers that you have
Right,
to.
right. I think definitely what we want to see in our careers, in our career development is actually getting recognition on different scales over time. So at a local level, and then at a national level, and then at an international level, developing recognized expertise in our given area of work. And so that does come in the form of presentations, publications, and talks and interviews.
There you go.
Yes.
Well, I really appreciate you taking the time again to visit with us, and it's always a joy to me to speak to the people who may be part of the cure for this or that, whether it be hepatitis or HIV, but it looks more and more promising.
It does.
But every time you turn a corner,
Yes.
darn,
Yes, right.
we just missed it there. There wasn't
getting a little closer.
quite enough like Tim Hendricks with the Boston patients.
Right.
But I did visit with today with the Berlin patient, and we did a long interview with him, and it's always good to see, at least no matter how rigorous it might have been for the cure
That
for him.
there's a way.
There is a way, so that's inspirational.
Yes.
Yeah.
Thanks for having me again.
Thank you very much.